You may have a bad case of the blues. Enjoy this presentation to learn more about geriatric depression screening. I'm your presenter, Dortasia Charles,
And I'm your presenter, Taisha Scott.
and today we will discuss why you should get screened for depression at your next primary care visit. The healthy people goal that we are focusing on is increasing the proportion of primary care visits where adults are screened for depression. Based on our healthy people objective, our educational goals is for adults to understand what depression is for those who are 65 years and older, and also understand the significance of depression screening and primary care visits. Before we begin, I would like for you all to take a moment to ask yourself these questions. It is okay to be vulnerable during this time, and the results from this is not the end all. First question is, have you dropped many of your activities and interests? Second question is, do you feel that your life is empty? Third question is, are you afraid that something bad is going to happen to you? Fourth question is, do you often feel helpless? And the last question is, do you think that most people are better off than you are? If you answered yes to all five questions, then you might be entitled to compensation.
Now we will begin to define and identify depression. Depression, also known as major depressive disorder, is a common mental disorder that affects both your cognitive and behavioral abilities. This disorder alters multiple dimensions of your life, including but not limited to emotional, physical, and social health. Depression is also characterized by persistent sadness and a loss of interest in activities previously found enjoyable. On average, such feelings typically linger for 2 weeks or longer. Now, you may be wondering what symptoms are associated with depression. Keep in mind that you do not have to experience all of these, but it is great to be aware of them as you monitor your emotions. As we mentioned before, depression is the persistent feelings of sadness and hopelessness. Many people feel a sense of emptiness and that life just isn't worth living or has no purpose. Others also report the loss of interest in previously enjoyable activities or hobbies. Reoccurring thoughts of suicide, suicide attempts, and suicide are typically experienced when depression becomes more severe. At this point, you should consider reaching out to your doctor or support system. Lack of energy or extreme tiredness is a common symptom of depression. One way to notice this change is by examining if you are sleeping more than usual for a longer period of time or not sleeping at all. Your quality of sleep may also worsen. You know something is up when you stop craving your favorite applesauce or midday snack. Changes in appetite are super common, and you may find yourself not enjoying foods you used to enjoy or eating more than usual, leading to weight gain. While this list isn't exhaustive, these are the commonly found symptoms of depression. There are also some interesting statistics regarding depression that many individuals are unaware of. If you have ever felt like an outlier, you are not alone. In fact, according to the Center for Disease Control and Prevention 2022, approximately 2 million Americans ages 65 and older have experienced some form of depression. To delve into this a little further, 1 to 5% of these individuals are in the general community. 14% include those that are in assisted living or home health care, and 12% are in the hospital. It is clear that depression has an extreme prevalence in the community. According to the American College of Preventive Medicine, has suggested there needs to be a system to screen older adults for depression because older adults have the lowest percentage of obtaining mental health treatment. Mental health is a sensitive topic that surrounds a lot of stigma and misconceptions. No one wants to feel like something is wrong with them or that they are sick, especially when at a critical age. It is important to realize that having or experiencing depression is not your fault. It is a part of life, and seeking help makes you stronger, not weak. You can still live a normal life with independence. Also, if one is diagnosed with depression, that does not automatically equate with being put on medication. If you don't want to take medication, you can speak with your doctor and discuss other holistic treatments or therapies.
How to approach your doctor. Being vulnerable and feeling comfortable enough to talk about sensitive topics with your doctor is not an easy feat to achieve. However, there are many benefits behind forming a connection with your health provider. A study reported that older patients who are socially isolated, emotionally vulnerable, and economically disadvantaged tend to benefit from close relationships with their provider and their support given. With that being said, here are a few steps you can take as a patient to break that barrier between you and your doctor. One of the most important things to remember is that honesty is key. Do not be afraid to share everything with your doctor because the details about what you're experiencing will only help you in the long run. Furthermore, coming to your appointment with questions is essential. As the famous quote states, the only stupid questions is the one not asked. As your provider, they are more equipped to handle your concerns and inquiries. Doctors anticipate patients coming to them with questions as it helps them to understand their condition more and makes it easier to find the best fitting treatment. At the end of the day, visits to the doctors are always unnerving. So you feel like you still need some more support and do not hesitate to bring someone along with you, a relative or a close friend that may help you feel more secure and comfortable. In order to decide if you have depression, your doctor may put you through a depression screening, which is basically a standardized test with the set answer with yes or no. This test is very quick and short, and it only takes approximately 10 minutes to complete. What screenings look like? If you suspect that you may have depression based on your responses to the GDS shown earlier, it will be good to bring up screenings in future visits. Compile some notes and expand on the response given during the GDS so you can bring it to your doctor. Generally, screenings are going to look similar to the GDS, so be prepared to be asked questions about your mood, feelings, quality of sleep, etc. The Patient Health Questionnaire 9, or PHQ-9 for short, is a prime example as to how screenings can be set up as they are used for screenings and diagnosing depression in individuals. On the slide, you see examples of both the PHQ-9 and the GDS, and while they ask similar questions, the PHQ is more specific and your score indicates the severity of depression you have. For example, if you ended up with a score of 4, you'll be described as having minimum depression. But if you find yourself within the 20 to 27 range, then your physician would say that you have been experiencing signs of severe depression. Why should you be screened? Older adults count for 18% of suicides, but only make up 12% of the population. This is an alarming statistic, but this needs to be shared and talked about. Many of these deaths were a result of loneliness, depression, or other mental health issues. It is vital to report any signs or symptoms to your doctor, nurse, or provider because one study found that older adults who committed suicide because of depression visited their medical provider a month prior. By having these open conversations and practicing self awareness, we can prevent depression from reaching this point. Please, if you are having suicidal thoughts or struggling, dial 988, which is the suicide prevention hotline. You can call anytime and any day. Now, here is a short animation to show what a screening will look like in the doctor's office. Participating in depression screenings are vital and have proven to show its effectiveness in a study. In a study with over 150 older adults who voluntarily took the survey, in which they indicated if they suffer from depression, as a result of taking this survey and the screening, 14.3% endorsed symptoms consistent with a depression diagnosis, and nearly half reported a prior history of depression. These statistics show that if these individuals never took the depression screening or never was contacted by their provider to take a depression screening, they probably wouldn't went through their life fighting this mental illness when they could have easily gotten treatment and support for their depression.
How to improve the quality of life. Apart from screenings and the treatment provided by your doctors, there are activities that you, as the patient, can take up to help with your mental health and improve the quality of your life. For example, you could pick up a hobby, exercise the mind, or even keep in touch with loved ones. Society may say that you are old, but don't let that stop you from getting your funk on. Organizations that can help. Why not take it a step further and look into organizations that can provide you with even more support for you and your mental health? Here are just a few resources that specialize in mental health care for seniors. Feel free to take a picture. As we begin to wrap up this segment, we'd like to reiterate our main topics of today's presentation. Depression is a common issue all throughout the world, not excluding older populations. Symptoms include persistent sadness and hopelessness, loss of interest in activities, and more. Medications for other medical issues can have depression as a side effect. You can ask your doctor questions, reach out to loved ones, or pick up hobbies to improve your quality of life. Getting screened for depression is very important, especially in older ages. Mental health is such an important topic. A doctor should create a comfortable atmosphere in which asking for screening should be relatively easy. And having this knowledge is for your own good. Thank you for your time. Here are some additional resources for you to look into. Feel free to scan the QR code or type in the URLs attached below them.
Thank you.